Hello, my name is Jacob White. Today I'm going to show you how to use the Pneumofix decompression needle and its indications and usage in the field for EMS. So the usage indications for a Pneumofix would be any kind of suspicion of a pneumothorax, a hemothorax, or a combination of both. So more than likely those will be caused by some kind of blunt force trauma or penetrating trauma to the thorax or the chest. So typically if you have any suspicion of a pneumothorax, hemothorax, here, per the protocols, you're allowed to decompress the patient to relieve either the air or the blood that's trapped there in the pleural space. So, also, the other signs could be any kind of hypotension associated with it, so systolic blood pressure of less than 90, any kind of tachycardia, respiratory distress, or any kind of tachypnea. So when you get your kit out, what you'll have in there, you'll have your Pneumofix decompression needle, a set of sterile gloves, a 10 cc syringe, a scalpel, and then a betadine swab. So what you're gonna do here is you first get all your equipment ready first, and then you'll put on your sterile gloves. You're using the sterile gloves because you're gonna be inserting some kind of foreign object into the body, so you're trying to keep it as sterile as you can to prevent any kind of infection, secondary injury. So then once you have that done, you'll either find your second intercostal space on the midclavicular line or the fourth and fifth intercostal space on the mid-axillary line. And then once you locate it, use your betadine swab to prep the area and clean it and cleanse it. And then palpate, find your space. And if you have someone who's obese or has excessive adipose tissue on their body, then you'll use your scalpel here, and you can make a small incision about 1 to 2 centimeters in the area where you're going to decompress. And once that incision's made, then you'll go with your finger and again relocate your space in either your fourth or fifth intercostal space on the mid-axillary line or the second intercostal space on the midclavicular line. And then once you locate your space, you just pull out your needle here, just a very long needle. And then once you get it, you'll place it, push it in, and then once you feel the needle and the catheter go in, then you'll advance your catheter over the needle, and then exit the needle from the body and leave the catheter in place on the decompression site. And then say once you got it there, and say you had someone who had a lot of blood due to hemothorax, you want to aspirate it out, then you could utilize just a simple 3-way stopcock screwed onto the one end here of the decompression needle. Then you can get your syringe out. And then you're able to aspirate blood out of the needle as well. And once it's in there, you also want to secure the catheter inside the body. And then if symptoms continue and persist, then you just place a second decompression needle next to the first one, or you can change to the midclavicular space if you already did the mid-axillary space, vice versa. Thank you.